Hey everybody, I want to talk today about what I think to be one of the bigger health problems, if not the most fundamental health problem, which is we have an education problem. We don't know how to care for ourselves. We don't know what's right, what's wrong. We don't even know how to think about what's right or wrong at times. And so something that's really important to me is this idea of being a doctor. Now the root word of doctor, I guess it's like a Middle Ages Latin word or medieval Latin word, doctor, which meant teacher or advisor, or I think even scholar. The point is teacher. I think that's really important. I think that's a lost aspect of being a doctor. So our job is to teach, means to educate. What does educate mean? Well, the etymology there is, well, there's a few related words, but the one I'm going to use is educere, which really means to bring out or to bring forth, which would mean like there's this innate knowledge or wisdom within, and then to be educated means to have that brought out or to have that realized. And so I think that's really important. Now, why are we not educating more as part of our health system? Well, that's an interesting question. I think part of it is the education system as a whole doesn't really work that well. You learn a lot of things in med school or chiropractic school, DO school, counseling school, massage school, whatever. You learn a ton of information, so it's pretty good at gathering information, but doesn't necessarily teach you, say, how to teach or how to have maybe a critical thought or how to take information and then do something with it. And that's ultimately, I guess you could say, applied knowledge. But I think the big issue we're not seeing it is not that doctors can't teach, it's that they don't really get paid to, especially in bigger settings like hospitals. Essentially what you can bill for in a hospital is billable services, which are typically things like lab testing or procedures or like materials and things like that. But if you're going to bill a third-party payer, you're going to bill what they'll reimburse you for, and they don't reimburse for conversation. I think that's a problem. So if you go to a doctor and you're paying out of pocket, good chance maybe you get more of a conversation with them. Maybe you can ask them real questions and they can guide you, right? They can be that advisor or that teacher. But in hospitals, which are just really expensive to run, and doctors are very expensive to pay, you're going to use doctors for things that get reimbursed. And so that might be fundamentally a big issue. So what's the practical aspect here is, well, if you're a doctor, find a way to teach. So even if you're working at a hospital and you just don't have the time to teach, or it's not the right setting, or you can even get in trouble for misuse of time, then find other ways to teach. Volunteer in the community, go to schools, go to small groups, churches, educate, allow people to know how to care for themselves, how to be healthy. That's a really good idea. And if you're a person looking for a doctor and you want a doctor, you want an advisor, you want someone who can guide you to be healthy, then find one and challenge your doctors. Ask them really hard questions. I always appreciate when people do that for me. It always helps me to be better. It makes me think differently. And honestly, I learn a lot from working with patients, a lot more sometimes than certain textbooks. So keep the conversation going. And keep in mind, what you might have to do at this phase is work hard to self-educate, which is going to be part of your self-care routine and self-health for you and for your family. And again, part of the education is channels like this. So if you like this, you can subscribe, you can share it, and then you can comment, ask specific questions that you have about health, and then I'll talk about it. Or if I don't know, I'll bring someone on my channel who can talk about it. All right, thanks guys. Love you. Bye.